Hi, my name is Osman, and I'm working as a community engagement specialist at Cancer Council Victoria. And it's my pleasure here today that I have Clem. Clem, would you like to introduce yourself?
Oh, thanks, Osman. Yes, so my name's Clem, and I'm a cancer nurse that works on 131120, the Cancer Information and Support Line here at Cancer Council Victoria. So 131120 is a number that any Victorian can call if they've got questions about cancer, the causes of cancer, preventing cancer, or treatment, or anything else related to cancer. So, yeah.
Thank you very much, Clem. Well, today we are going to be talking about bowel cancer and bowel screening. So, for you, or in simple words, like, what do you think? What's bowel cancer for you, or why should we know about it?
Sure. So, bowel cancer it's certainly a big problem here in Australia, Osman. It's actually the second leading cause of cancer-related death in Australia, and that's behind only lung cancer. So many people, unfortunately, are getting bowel cancer in Australia and having, very long and difficult treatment for it sometimes, and unfortunately, many people are dying from it. I suppose from the point of view of a cancer nurse, there's really good news and bad news about bowel cancer. The good news is that bowel cancer is one of the only kinds of cancer that we've got a really good screening test for. So we've got a really accurate, sensitive screening test that people can do in the privacy of their own home to find out if they're at risk of developing advanced bowel cancer. And and that's great news. And if we find you know bowel cancer early, over 90% of people can be cured of it. The bad news, though, is that even though we've got this test, very few people are doing it. Only about 40% of people do this free test when it's sent out to them.
Hmm. So, what are the symptoms of bowel cancer? Like, how would I know that I have got bowel cancer?
Yeah, sure, Osman. So sometimes people might notice some pain or discomfort in the abdomen region. There might be a change in their bowel habits, so people might develop constipation or diarrhea. And sometimes they might notice blood in the toilet. But it's important to say, Osman, that for lots of people, they can develop bowel cancer without noticing any symptoms. And that's where this free bowel testing kit comes in, because it is sensitive enough to pick up very early stages that people might be starting to get a problem. And the kit's sent out every 2 years from age 50 to age 74 to everyone in Australia. So if someone developed some symptoms that I was talking about, I'd go straight to the GP to be assessed for those symptoms. But if you've got no symptoms, it's really important that you do the bowel testing kit when it's sent out to you.
So, like, there are a number of communities that might be or think are saying that um, they could be more vulnerable of developing bowel cancer. Like, or some people are saying that men are more vulnerable than women in developing bowel cancer before the age of 75 years old. Is that true, or it's not? It's not a big difference.
Yeah, so I mean, it is true that men are at slightly higher risk from bowel cancer than women are, Osman, but many women also develop bowel cancer. So it really is a big risk to both men and women. And it's also true to say that there are other groups in our community that we would think of as underscreened. So I said to you before that at the moment, only about 40% of people who are eligible to do the test actually return it completed. Um, and in some groups, say Australians who don't speak English as their first language, Aboriginal and Torres Strait Islander people, um, and Australians living with disabilities, the numbers are even lower than 40%. So that's many more people who are missing out on the benefits that doing the bowel cancer screening test could give them.
Mm. So, and you briefly spoke about the bowel testing kit and its role in discovering bowel cancer early. Um, Talk to us about the bowel testing kit and when I'm going to get it, if
Mm.
if or should when should I expect it to receive it at home?
Sure. So the bowel testing kit is sent out from the National Bowel Cancer Screening Program, which is part of the federal government. It's free. It's people can do it in the kind of comfort of their own home. It's easy and hygienic to do the test. Um, it is sent out every 2 years from age 50 to age 74, and it's sent out to people's Medicare address. So if your Medicare address is up to date with your current address, the test should arrive in a month or so after your 50th birthday and every 2 years after that. And in order to do the test, the National Bowel Cancer Screening Program website actually has a really simple little video that you can watch about how to do the test, but it involves taking two very minute samples, and I guess there's no polite way of saying this, two minute samples of your own poo, just about the size of a grain of rice, putting them in plastic sample containers, and they are sent to a laboratory for analysis.
But some people might feel that it's uncomfortable to, like get a sample from their poo and so on. So, what would you like to say to those people?
Yes, I think that's right. I think there's lots of reasons why people are probably not doing the test kit at the moment, and that's includes embarrassment or feeling that it might not be hygienic or things along those lines, not liking to talk about their bowels or even think about bowel cancer. Um, but this is causing a lot of people to miss out on the benefits of the bowel testing kit. And if we pick up, the presence of bowel cancer early, it can be treated very simply, very quickly, and not very invasively. Whereas if it goes on another year or another 2 years until people are really showing symptoms, it might be a very long course of treatment, or a lot of people are dying from this disease and dying when they don't really need to. So I would say, for your own peace of mind, a little bit of embarrassment is a small price to pay. And the kit has been designed to be very simple and very hygienic to use.
And well, look, I don't have bowel cancer. But if I want to minimize the risk of getting bowel cancer, yeah, are there anything that I can do, like any habits that I should change to minimize my risk of getting bowel cancer?
Yeah, sure, Osman. So there's actually lots of information on the Cancer Council Victoria website about how people can reduce their risk of bowel cancer and other cancer. Some of the things we often talk about as nurses include losing some weight, if people are overweight, eating a healthy diet, exercising a bit more, um, reducing alcohol consumption, not smoking. So all of those things are, you know, beneficial. But it's also important to say, Osman, that lots of people who develop bowel cancer don't have any of the risk factors for developing bowel cancer. So really, the number one best thing that people can do to reduce their risk of having serious bowel cancer is to do the test kit and return it complete when it arrives in the mail.
Well, I can't wait till I get to the bowel testing kit and do my bowel testing or bowel screening. But if I need more information about bowel cancer or bowel screening, where can I get this information from?
Sure. So on the National Bowel Cancer Screening Program website, there's information. There is also a bowel screening test kit helpline that people can call, and the number for that is 1-800-930-998. And that's for information specifically about the bowel testing kit and help knowing how to do it or any questions like that. But if people want more general information about cancer and cancer prevention, I would encourage them to call us at the Cancer Council, 13 11 20 Cancer Information and Support.
Thank you very much, Clem. It's a lot of information, and I really appreciate your time. Thank you very much.
Well, thank you, Osman, and hopefully we can get more people doing this really important test kit.
For sure. Thank you very much.
All the best. Bye bye.
Bye bye.